I'm Najaswat for BizNews.com, and I'm speaking to Jayne Bullen, the COO of the Noakes Foundation, the Managing Director of the Nutrition Network, and co founder of Eat Better South Africa. Jayne, thank you so much for joining me. So, obtaining even one of the aforementioned high level positions is a significant achievement. So, you hold three. What is your background?
So I started in marketing and market research.
Okay.
And a couple of years ago, when I joined the Noakes Foundation, I made the decision that I had to do things that involved principle over profit
Mm.
and made this kind of transition over to heading up the Noakes Foundation. And obviously, since then, we've co created all of these businesses and spin offs and things that have grown from the original mothership that was the Noakes Foundation. Mm.
And it seems clear that the passion and the goals are the advancement, the promotion of human healthcare. What happened in your life that sparked this passion, or has it just always been a cause close to your heart?
So it's a combination of things. The first was that I lost my childhood nanny that I loved dearly very young. She was young, she was morbidly obese, and she was ill. And she dropped dead of heart attack. I think she was in her very early 50s. And that was, she was like, I mean, as South Africans, we know that she was like my second mama. I absolutely loved her. And she had a huge influence on my life. And her death, untimely death, sparked that question in my mind, which is why are so many, particularly women in our country, unwell and dying early of diseases that that didn't seem to exist before. So it's always been in my mind. And then when I was 21, I was diagnosed as pre-diabetic and have been on a long health journey myself with the journey of so many. I mean, it's obviously, I've learned now over these years that it's such a universal problem that we're all facing, which is that I was eating the wrong foods for a very long time and doing all the right things and exercising and eating what was perceived to be health foods, and getting worse. So my metabolic disease worsened over those years significantly, till the point where I had to make a dramatic change in my life in terms of the way that I was eating and go against convention to find some of the answers. So it was a combination of those things that really got me really excited about the work and the potential that this work has to help improve the health of our country in South Africa and more internationally, because we're all fighting the same battles.
What has the outcome of your journey been since you made this shift?
So I've found a way to stabilize my health and to have vitality again for the first time. And what I've had the blessing of is working with thousands, if not hundreds of thousands, whose lives are changed by making these simple changes. So what we see is normalized health, like from ill to well.
Mm, such a simple shift. But talk to me about these respective organizations. Let's start with the Noakes Foundation, the mothership.
So the Noakes Foundation was founded by Prof. Tim Noakes, obviously, and his amazing family. And it was very much his journey. So he lost his father to diabetes way too young. And he had a very, very personal cause behind, trying to understand the answers of why his father was so sick. And there was very little that anyone could do to help him. And then he got diagnosed at the exact age that his father was. And he then went on this journey where he defied convention, rebelled, and fully reversed his diabetes. And in the process, incidentally, having actually retired, made some money and decided to put it into this foundation as the seed capital for the foundation. So that was where we started. We started at the real meal revolution in South Africa, when there was this kind of revolution of ideologies and the way people were eating, and we grew from there. So that was where we began, and then very, very quickly we did a pilot study on a group in Ocean View, which is an underserved community outside of Cape Town, for those of you that aren't South African and don't know it. And that was really a couple of us that came together and decided that we had to do something to fix the crisis in the underserved or poorer communities in South Africa.
Mm.
And we all know it, we all see it. We see people walking on the roads that aren't, it's illogical that they are the size and the health that they are.
Mm.
And we knew something had to be done. And it was obvious that state healthcare wasn't tackling this. I think that's the problem that we faced, is it's not being tackled or addressed at a kind of policy level quickly enough to save the decades of lives that we're losing now. So we wanted to do something innovative and quick, and it worked. That was where we created Eat Better South Africa from.
What are the current projects that these organizations are working on?
So Eat Better South Africa is focusing very much on, it's just started a research study with younger children for the first time. So we're looking at how to improve. What we've done in the past is we've done a strict banting intervention. So we've taken people, groups of women from underserved communities through a 6 week low carbohydrate diet and a lifestyle intervention. And it's been very formal and very structured, medically supervised. What we're about to start on is something really exciting, which is a 2 year study in a group of students, quite young school learners at primary school. And we're looking at changing what we obviously we're not putting them onto a keto or a banting diet, but we are changing the porridge and the pups that they eat into something that's more balanced and comprehensive, and looking at their performance markers. So we're looking at their concentration and their cognitive changes over 2 years, which is long enough to really what to know to quantify what we know, which is that it will change the outlook of their lives for the better if they're eating better from an early age. So that's one of the projects that we're quite excited about. We've also rolling out nationally with our health coaches. So we've been quite focused in the Western Cape because we all live here. So we're looking at we have some health coaches in other provinces now, and we've got much more of a national footprint, which we're really excited about. That's on Eat Better South Africa. And then the Noakes Foundation has expanded a little bit into academic research and free speech
Hmm.
as a sort of more recent initiative that has been much more involved in, with some exciting things like a new podcast that's come out and some really, really exciting studies. We've also just finished a big study that we did for the macadamia industry. So Noakes Foundation tends to do kind of slightly higher level, more medical research, coming off the back of Prof. Noakes's career in sports science. So we do some really, really exciting research studies into, low carbohydrate eating typically.
How receptive have you found the communities to be to this educational offering?
Absolutely amazing. They jump on. I mean, and that's the thing that we found so unexpected was how people just want these basic tools to change their lives for themselves. And obviously, it's come from desperation. So we find people that are desperate and that are sick come onto our programs for a sense of hope. They've kind of been down quite a lot, not all of them, but a lot of them are ill, and they've been down a journey with their diabetes. Most of them present as hypertensive, and they haven't found solutions to improve their health.
Mm.
So they're not at the end of their road, but they've recognized that what they're being offered through healthcare doesn't make them healthier, tends to make them sicker. They tend to. So in South Africa, typically, I mean, you probably know this, but for example, if you're in state healthcare, we have the people who have private medical aid and people who have public healthcare, and the difference is so fundamental that it's almost like a differentiator in terms of quality of life. And I think it's 86% of South Africans don't have private healthcare. So they are at this kind of, they're reliant on state healthcare
Mm.
help them. And what happens, particularly if you're diabetic, for example, you go once every 3 months, you get a finger prick, blood pressure, a nurse or a diabetes educator sees you. Typically, your medication is increased because it hasn't improved over the last 3 months. Your sugars have gone up because you've been given the wrong advice. And off you go with what the ladies on our programs call their party pack, which is literally a packet of pills. And off they go home and they don't get better. And what we know we can do within 6 weeks with people is we can reduce their blood sugars to potentially normal levels,
Mm.
and definitely their blood pressure to a normalized state over that time, and then change the outlook of their lives.
And you've mentioned to me in one of our previous conversations that the accumulation of global participants in these three organizations is something around 6,000. That's a huge global expansion. Talk to me about the people that you have involved in
So
these
this
organizations.
Absolutely. So this is the Nutrition Network, and we launched that. So that was the kind of third branch of our group that's kept growing, and we really launched that. I mean, part of it was from the learnings on Eat Better South Africa. Every time we went into a new community or a new place, we didn't have doctors, nurses, dietitians, people on the ground that actually understood the work that we were doing. So we started to identify the need to train them locally and to have places to send patients, and what happened was it was an international solution, not a South African one. So it turned into something that was global. So we're now in over 80 countries, and over 6,000 doctors and dietitians and physicians have done our trainings, which is really amazing. And it's growing constantly.
To your mind, what is the greatest obstacle that we face as a population, both nationally and internationally, to the improvement of human health?
So, dietary disease
Mm,
is, and I'm going to say it's dietary disease, and lifestyle disease. So chronic disease or NCDs is taking over, most of the other things that we previously considered life-threatening conditions. It's taken over AIDS and HIV by far in South Africa. Diabetes is one of our number one killers, as is, if you bundle them together. So if we put hypertension, diabetes, and cancer into the same category, because our understanding of the physiology of them is that they are driven by dietary and lifestyle conditions.
mm,
It's outright the number one killer in the world. And these are the tragedy of this is that we actually just need to eat slightly differently and do things slightly differently to be well. It's, we our food is poisoning us, and our food is meant to be our medicine. So we've got a lot of work to do in that area, but the solutions are incredibly simple,
mm.
ultimately.
And just to close off with, this is in particular reference to BizNews has been publishing two series now, but the central focus being Ansel Keys' Cholesterol Con. And the detail is just, I would encourage anyone that has even a small interest in this to go read the series, because it's exceptional. I mean, people follow it like chapters of a book every week. But it just highlights that for something like 6 decades now, people, especially the medical fraternity, have been brainwashed by unsound science. To what extent do you think that the medical fraternity is still captured by such a fundamentally flawed model?
It's a very difficult question because obviously daily, we work with people that have converted to the new, what I would see as the new paradigm of medicine, which is treating the patient as an individual and looking at what they eat, how they live, what their stress levels are like. But ultimately, mainstream medicine is still very, very much pharmaceutical driven and driven by incorrect science. So it's the tragedy is the majority of patients are never going to, unless we scale dramatically the knowledge base, which is we're working on doing it, but can we do it quick enough, are still going to be told their cholesterol's too high, they've got to eat a low fat diet with lots of whole grains, which is ultimately, in our understanding, a recipe to early suicide.
Just highlights the importance of the work that you guys are doing, and we'll be following it with great interest and enthusiasm. Jayne Bullen, COO of the Noakes Foundation, MD of Nutrition Network, and co founder of Eat Better South Africa. And I'm Najwa Swart for BizNews.com.